Bismillahirrahmanirrahim. Hello everybody. A 35-year-old obese woman, gravida 2 para 1 and at 31 week of gestation come to the physician with severe heartburn and upper and right upper quadrant abdominal pain. She had experienced several episodes of nausea and vomiting this morning. The patient has had gastroesophageal reflux disease throughout the pregnancy, but the symptoms have rapidly become much worse. During her visit last week, she has fatigue and her blood pressure was 130 by 80 mm of Hg. Current blood pressure is 160 by 90 mm of Hg and pulse is 86 per minute. Physical examination show extreme tenderness to palpation in the midline and right upper quadrant of the abdomen, but absence of peritoneal sign. Fetal heart tones are audible using Doppler ultrasound. Laboratory results are as follow: hemoglobin 9.7 gram per deciliter, platelets 80,000, total protein 6 gram per deciliter, albumin 2.6 gram, total bilirubin 2.2 milligram per deciliter, direct bilirubin 0.5 milligram per deciliter, alkaline phosphatase 170, aspartate aminotransferase 112, alanine aminotransferase 124, lipase 80. Urine dipstick show 2 plus protein. Which of the following is the most likely cause of this patient right upper quadrant pain? Right upper abdominal pain: cystic duct obstruction, distension of liver capsule, fatty infiltration of the liver, pancreatic inflammation, peptic ulcer, perforation, rupture of a hepatic adenoma. So first of all, this patient having eclampsia, because first of all this patient have eclampsia because she having hypertension, of 160 by 90 mm of Hg, and she came to us at 31 week of gestation, and there is 2 plus urine proteinuria on urine dipstick, so proteinuria. So diagnosis of first this question is severe preeclampsia, and second she having anemia because her hemoglobin is 9.7 milligram per deciliter and platelets 80,000 milligram per deciliter, and her liver enzyme are also elevated because alanine, alkaline phosphatase, aspartate aminotransferase, alanine aminotransferase are all elevated. So this patient is suffering from HELLP syndrome, because HELLP syndrome, this patient the cause of HELLP syndrome is severe preeclampsia. I will explain to you that what is HELLP syndrome. So HELLP syndrome is first H hemolysis, because this patient hemoglobin is 9 gram per deciliter, hemolysis. Second, elevated liver enzyme, because this patient also have elevated liver enzyme. And third, this patient have low platelet, as we already see here that this patient has low platelets because her platelet count is 80,000, low platelet. So this patient first is suffering from preeclampsia. With preeclampsia, the patient develop HELLP syndrome, which is hemolysis, elevated liver enzyme, and low platelet count. So here the correct option is choice B, distension of the liver capsule. Why the choice B? Sorry. So here the correct option is choice B, distension of the liver capsule. This patient clinical features are most consistent with HELLP syndrome. HELLP syndrome may be a variation of severe preeclampsia and affect 10 to 20% of women with preeclampsia. Serious liver problem includes centrilobular necrosis, hematoma formation, and thrombi in the portal capillary system. These processes can cause liver swelling with distension of the hepatic Gleason capsule, resulting in the right upper quadrant or epigastric pain. This patient is hypertensive and has sign of hemolysis, anemia with indirect hyperbilirubinemia, elevated hepatic transaminase, and thrombocytopenia. Alkaline phosphatase is normally elevated in pregnancy. This patient also have, as we already see, as we can see here, that this patient albumin count is 2.6 milligram per deciliter. So albumin is decreased, as we already know that normal albumin is 3.4 to 5.4 gram per deciliter. And we will also see here that this patient have total bilirubin. Total bilirubin count is on this patient is 2.2 milligram per deciliter, and total bilirubin is 0.1 to 1.2 milligram per deciliter. Come to the direct bilirubin. Direct bilirubin is less than 0.3 milligram per deciliter, and here it is 0.5 milligram per deciliter. Now come to the incorrect one. Why the choice A is the incorrect? Cystic duct or obstruction. Because obstruction of the cystic duct may cause right upper quadrant pain, fever, and elevated hepatic marker. However, symptoms of thrombocytopenia and severe hypertension are more consistent with those of HELP syndrome. Choice C, fatty infiltration of the liver. So many features of acute fatty liver overlap with those of HELP syndrome, but patients with fatty liver infiltration of the liver are more likely to have additional extrahepatic complications such as leukocytosis, hypoglycemia, and acute kidney injury. Choice D, pancreatic inflammation. So, as we already know that lipase is normal in this patient, making the diagnosis of pancreatic less likely. Choice E, peptic ulcer perforation. So, patient with peptic ulcer perforation have peritonitis with abdominal rigidity on examination and maybe hypotensive. Choice F, rupture of a hepatic adenoma. So rupture of a hepatic adenoma result in intra-abdominal bleeding with peritonitis, tenderness, and rebound, and hypotension from acute blood loss. It requires immediate surgical intervention. So I will again explain to you that why the choice B is the correct one. Distension of the liver capsule, because first this patient is suffering from preeclampsia, and with that preeclampsia this patient develop HELP syndrome. So what is HELP syndrome? HELP syndrome is hemolysis, elevated liver enzyme, and low platelet count. As we already see here, that all from this patient laboratory result, we know that this patient is suffering from HELP syndrome. So here the correct option is choice B, distension of the liver capsule. Thank you.